All right, here we go. So welcome everyone. I hope you're having a great day and are excited about the start of spring. I'm certainly excited, except for the pollen that's starting to coat my car already. But welcome to part 2 of the Nemours Children's Health Early Care and Education Resource Showcase. We're so very glad that you joined us today, and we're looking forward to sharing with you about some new learning collaborative resources that we have available, and to also introduce you to the Wellness Workbook for Early Care and Education. I am Calisti Chong, a manager at Nemours Children's National Office of Policy and Prevention, and our small but mighty team focuses on creating healthy ECE program policies, practices, and environments at both the state systems level and at the facility level in states across the nation. This is the second of 3 resource showcase sessions we're offering, and the recording of each session is going to be posted on the healthykidshealthyfuture.org website after the session has ended. So I'm hoping to get this posted, the recording of today's session posted by tomorrow, so that you all might go back and review it if you need to. We're also going to email out the recording of the session over the next couple of days for anyone that wasn't able to join us today, that registered but is interested. So during today's session, we'll ask for everyone to keep themselves muted. Please feel free to utilize the chat box and to share any thoughts or questions that you might have there. We certainly welcome any and all questions that you might have. And we're going to do our very best to address all the questions as we go through our time together today. And then we should have some time at the end to answer any other questions. And then if for some reason we're unable to answer all the questions, we'll reach out to you directly to provide any requested information. Next slide, please. So during today's session, we're going to share about the Nemours Children's Health Learning Collaboratives, which we affectionately refer to as the open source learning collaboratives, because all resources included in the Nemours Children's Health Learning Collaboratives are free and open for anyone to use. We're going to also introduce you to and provide a short orientation on the Wellness Workbook for Early Care and Education. And our fearless leader that's with us today, Rochelle, she's going to walk us through that portion. And then for both of these resources, we're going to share how you can access those materials. And then hopefully we'll have some time at the end for questions. Next slide. So let's jump right in. As I mentioned, I'm Calisti, and I've been with Nemours for almost a year and a half. And prior to joining the Nemours team, I started my early care and education journey as a learning collaborative trainer in Alabama around 7 years ago now. I think this month, 7 years ago, I started on this journey with the Early Care and Education Learning Collaborative. We were funded through Nemours and the Centers for Disease Control and Prevention in Alabama to implement the Early Care and Education Learning Collaborative project. And I very quickly began to see the impact that the Learning Collaborative approach had on the ECE providers that I was working with. And I became a strong supporter of the model. So much so that we secured additional funding to expand our learning collaboratives to different regions throughout Alabama. And we even created a Farm to Early Care and Education Learning Collaborative framework that's still being implemented now. So that's enough for me for now. I'd like to invite our associate Hannah Press to introduce herself, and she's going to share with me about learning collaborative resources we have today with you. Hannah?
Hi, everyone. My name is Hannah Press. I'm a senior program and policy analyst on the early childhood team with Nemours, and I'm happy to be here.
Thanks, Hannah. So Nemours Children has been using this learning collaborative approach with early care and education programs across the nation for over a decade now. And there have been many different iterations of the learning collaboratives that are focused on nutrition and physical activity topics. And we've worked through a lot of different updates over these last 12 or 13 years to develop the versions and to get to the versions that we have available today. Both the Better Together learning collaboratives that we discussed during the first resource showcase with Go Knapsack and University of North Carolina at Chapel Hill, and then also the Nemours Children's Health Learning Collaboratives that we're going to talk about today. So we began this journey in 2010, and Nemours designed and launched a learning collaborative pilot in Delaware, which Delaware is one of our children's health system's primary service areas. So the project was implemented there with some childcare providers. It was evaluated, and we found that the model, the learning collaborative model in general, was effective in helping ECE programs make healthy changes to policies, practices, and environments. And this led to the development of the National Early Care and Education Learning Collaboratives project that was implemented from 2012 to 2018. This is when I began my journey, and around 2016. So this project, the National Early Care and Education Learning Collaboratives Project, was funded by the Centers for Disease Control and Prevention. And many of you might be familiar with the ECELC materials that have been used in many different states across the nation to engage childcare programs in that type of comprehensive quality improvement process. And some of you have probably even used some of those materials. And please feel free to share in the chat if you have used those materials before and what your experience was with that. So by the end of the ECELC project with the CDC, we had developed and launched an updated set of resources that are on the Healthy Kids, Healthy Future website. And that included an implementation toolkit that's pictured on the screen on the left side there. And that implementation toolkit was really aiming to and striving to walk state project coordinators through the full process of planning and implementing learning collaboratives. So we wanted to provide everything and all the information, tips, and guidance that someone might need to launch a full learning collaborative in their state or in their particular region. That led to the updated version of the learning collaboratives was then offered early in our current CDC funded project, the Healthy Kids, Healthy Future Technical Assistance Program, as a springboard opportunity option. And our springboard opportunities, if you're not familiar, they're just very short-term projects where different types of resources and technical assistance are provided to different states that can apply. And that really helps them in different ways to catalyze and also to supplement some of the other early care and education work that they're doing in their state. So this also led to, and this is a whole continuum of different types of learning collaboratives and transitions, adjustments that we've made over the years, to Better Together, which we focused on during our first resource showcase session. And Better Together was a joint project between Nemours Children's and Go Knapsack at the University of North Carolina at Chapel Hill from 2019 to 2022. We actually did implement the learning collaboratives from 2020 to 2022 though. I think we actually have some of our Go Knapsack partners with us today. So welcome and thanks for joining to learn about these learning collaboratives that we have available today. Better Together was implemented in 4 states, in Arizona, Arkansas, Indiana, and Mississippi, was funded by a private foundation, ultimately to improve healthy eating and physical activity at the state system level and at the ECE program level. And then learning collaboratives were really only just one component of the project. There were a couple of other components of the project, and we focused our training efforts on ECE programs located in under-resourced communities. So through Better Together, we made some really significant changes and reimagined the learning collaborative process. We integrated the online Go Knapsack tools into the updated learning collaborative materials. And then due to COVID, because we're starting to implement the learning collaboratives when the COVID pandemic began to happen, we had to quickly adapt the materials so they could be used virtually. So those are 2 big adaptations that we had to make through Better Together. And if you want to learn more about Better Together, then you can watch our first resource showcase, and we'll share the link to that in the follow-up email if you don't have it already. So we very quickly realized that since the Better Together learning collaboratives can only be used in states that have an active Go Knapsack license, because it requires the use of the awesome online Go Knapsack tools that are available, we revised over these last couple of months the learning collaborative framework developed by Better Together to create an open source version of those materials to protect Go Knapsack intellectual property, and then also to make sure that we have tools that are available for any other state to be able to use, which we've named the Nemours Children's Health Learning Collaboratives. So what's new and what's different from Better Together? So let's talk through that a little bit. So for this version of the learning collaboratives, we've updated the resources based on the most recent experience and feedback from participating providers and trainers and coaches that implemented the learning collaboratives through Better Together. Even through some of my experience implementing learning collaboratives in the past, I used some of that to help guide some of the changes that we made with the Nemours Children's Health Learning Collaboratives. And then we really strived to incorporate the feedback of everyone that was involved in implementation to create a version that's adaptable and then also feasible for providers to participate in, knowing the changing childcare landscape that we have right now. So the trainer and participant materials, they've been updated for virtual delivery. And as I mentioned in previous iterations, I actually don't think I mentioned this. In previous iterations of the Learning Collaboratives, it was all formatted and created for in-person delivery. So whenever we went through Better Together, we had to reformat everything for virtual delivery. And I know that all of us had to pivot in lots of different ways throughout the pandemic, but we found that there are several positive project outcomes that came about due to this adaptation for virtual delivery, especially in relation to implementing learning collaboratives in a more equitable way. So traditionally, due to our in-person delivery in the past, participating programs were recruited from a small geographic area because all the providers had to drive in from different places to come to one location for that in-person training. And with virtual implementation, we were able to really reach providers that were located in more remote and rural areas, especially in Arizona. I'm thinking about a provider that was located in the Grand Canyon. Don't think that that provider would have been able to participate had it not been for virtual implementation. And it also reduced other barriers to participation as well, including reducing the amount of time that staff were actually taken away from their classrooms because they were virtual and because the trainings were provided at times like maybe during lunchtime or after hours. The providers were able to stay in the classrooms and be taken away from the classrooms a lot less than with in-person, where they'd have to travel sometimes up to an hour to get to a location and stay there for hours for the training. And then we also shortened the duration of the training. So instead of having 6-hour in-person trainings, we broke them down into 1-hour increments so that they could be a lot more feasible for the providers to participate in. The third bullet here is focused on improved usability for shorter, more flexible learning collaboratives. We definitely learned through Better Together, especially during the pandemic, and even now that providers have more responsibilities and more challenges than ever before. And we found that in order for them to fully participate and complete the full learning collaborative cycle, it was really necessary to shorten the timeline. So we've always included 4 modules with each one of the topic areas being focused on for different portions of the learning collaborative. But in previous iterations, we combined all of those and it created a 10 to 12 month long learning collaborative. So we actually broke them down into bite-sized chunks, we'll say, and each one of the content areas can be implemented as a standalone learning collaborative. So physical activity and nutrition, breastfeeding, infant feeding, screen time, they can all be implemented as standalone learning collaboratives rather than one full learning collaborative with all of the sessions combined. And it should take between 3 and 4 months to complete the full process of just one of those learning collaborative modules, which I think is much more reasonable now for ECE programs rather than a full year commitment. And then finally, we adapted the learning collaboratives for being able to use different types of self-assessment tools. For the purpose of providing these materials for wide use, we integrated the wellness workbook that Rochelle's going to talk with us about a little bit later. Traditionally, we use the Go Knapsack assessments, whether the paper assessments were used during the first couple of iterations of the learning collaboratives, or then for Better Together, incorporating the online version. But we understand that some states just don't have that capability to purchase a Go Knapsack license. So we wanted to create a version of the materials that can be modified so that whatever program assessment is available to a state or a trainer or coach or providers, that they would be able to incorporate that self-assessment program into the framework of the learning collaborative. And like I said, we did incorporate the wellness workbook into this version, but those slides can easily be removed and the learning collaborative PowerPoints can be adapted to incorporate another assessment tool in the process. Next slide, please. All right, so we've discussed all of Nemours' learning collaborative journey so far. Let's talk a little bit about what a learning collaborative actually is, just to give a ground level and to level set a little bit for anyone that might not be as familiar with learning collaboratives and how great of a framework it is for working with ECE programs to help them adopt healthy changes in their program. So learning collaboratives in general are a powerful way to support ECE programs through a process to improve their practices, policies, and environments. Ultimately, you are walking them through an entire process to learn and to assess and to make changes and create action plans and to keep moving forward. And we always encourage the providers to, once they're done with the learning collaborative, to keep making healthy changes and to sustain those changes that they've already made. And I feel like there's really magic that happens when the providers come together to learn together, whether it's in a virtual setting or an in-person setting. When they come together and network and encourage one another and build those relationships, and it just really helps them to even further make those changes in their program that we know that are going to really impact the children, the staff, the families that they're serving. With the learning collaborative framework, there's a lot of different ways to think about and structure learning collaboratives, but ultimately a learning collaborative is the process of bringing together a group of providers. In our case, it's early care and education programs. It could be a group of 10 to 25 programs, and they share with one another their collective experiences and their challenges. They have opportunities to practice new skills and share their progress. And then they also get to explore research and resources that are out there in the world as well. We use the leadership team approach, which is the diagram on the right there. For center-based programs that participate, we ask them to develop a leadership team. This usually includes 2 or 3 different individuals in various roles throughout the program. We know that the director, owner, whoever is in charge needs to be a part of the leadership team, and then they could include a lead teacher or assistant director, food service personnel or chef, any other types of roles that really play a role in making decisions and that can help implement changes in the program. For home-based programs, of course, it's usually just the owner that's on the team, but sometimes they might have an assistant or someone else on there as well. Then with the modules, for the Nemours Children's Health Learning Collaboratives, we have 4 modules, which are on the screen. Like I said, you can offer them as a single topic collaborative, or you can combine them to make a longer collaborative. With the structure, the next slide, each one of the learning collaboratives consists of either 6 or 8 learning sessions that are 1 hour each. So we tried with Better Together and the adaptations that we made, we wanted to make sure that each one of the training sessions were 1 hour each so that the sessions could be combined to make a longer in-person session if you wanted to, or if you wanted to implement it virtually, then you could have a 1 hour training and it wouldn't be quite as overwhelming as a 2 or 3 hour training. So we tried to make it as adaptable as possible so that folks can modify it to fit the needs of their providers and then also their reality for how they're choosing to implement their learning collaborative. So I will share, this is the timeline for the physical activity learning collaborative, and it has 8 sessions, 8 1-hour sessions. So physical activity and nutrition have 8 1-hour sessions, and breastfeeding and screen time have 6 learning sessions, just because there wasn't quite as much content as physical activity and nutrition. Next slide, please. And we could talk a little bit about the learning collaborative sessions, but there's a lot of different things that go into the sessions. You have the learning collaborative sessions, which are the trainings. You have the action periods that come after the sessions. You have the technical assistance that's provided to the ECE programs as they're going through and working through their action period tasks. And then, of course, they have their celebrating success, and our final session is always a celebrating success session to bring everyone together, to give them an opportunity to share all of the great changes that they made in their program. So I will turn it over to Hannah now to talk us through some of the resources that we have available.
Thanks, Khaleesi. Yeah, I'm going to highlight some of the resources and materials that we have available through the Nemours Children's Health Learning Collaboratives. We really tried to be thoughtful about the way we put together these materials to provide all of the support and guidance needed to plan and implement Learning Collaborative. So this first one that's being shown right now that we want to highlight is the Implementation Toolkit. And this is a great guide for anyone that wants to host one or more learning collaboratives. And within this toolkit, there's a lot of great information. We've included examples of how past learning collaboratives have been implemented and tools and ideas of what to think about, such as considerations for choosing between in-person or virtual or a hybrid model for when somebody decides to deliver a learning collaborative. It's split into two sections. As you may be able to see, there's the planning section at the top and the implementation section, and that will walk you through the entire process of leading a learning collaborative. And what's really great about the implementation toolkit is that it's really adaptable and can be used in multiple settings. It can be used by somebody that's a state level coordinator looking to host multiple collaboratives in multiple areas of the state, or it could be used by a single trainer that's working in one part of a state or with one group of providers. So whether it's for statewide use or more singular, we've really tried to adapt the materials and the content to meet the needs of the trainer, of the folks leading it. So the next resource, next slide that we're going to highlight is the resource guides. So right here, you'll see this is our overall resource guide that includes all 4 of our content areas. And the audience for these resource guides are the childcare providers that are participating in the learning collaboratives themselves. They include a variety of resources on the different content areas and include worksheets that a provider or a leadership team might use to help support the work they are doing with their childcare programs, like supporting the training of childcare providers in the program. So as I said, the full resource guide is broken down into those different modules. And as Khaleesi mentioned, there was the celebrating success and continuing the process of change. That was that last content area. And it has a great worksheet that providers can go through to think about sustainability after the learning collaborative. But as you can see, there are also the 4 resource guides. If a learning collaborative is just run in one of these content areas, we have our breastfeeding support and infant feeding resource guide, our child nutrition resource guide, one for physical activity, and then finally one for screen time. So we also have PowerPoints for each content area with suggested speaker notes, and everything you need to host a learning session can be found within the PowerPoints. We have provided a suggested script for each slide, but that can be modified by each trainer to make the content relevant for their audience, whether including personal stories or local resources. I wanted to note that the wellness workbook is fully integrated into these PowerPoints, including slides about how to register for the wellness workbook and information on completing the self-assessments. But the slides are adaptable to other assessment tools. And so trainers can replace the wellness workbook slides for whatever assessment is applicable to their state and to their participants. So after sharing what materials we have available, I want to highlight how to access them. So the first way to access these resources is through the implementation toolkit. This image on the right is what the second page of the implementation toolkit looks like. And all of these resources are linked. So everything you need to implement a learning collaborative is just a download away from one of the links in the implementation toolkit. And then the second way to access these resources is through the Healthy Kids, Healthy Future website. We, as of this morning, launched a new page that's the Nemours Children's Health Learning Collaboratives page. And on the right side of the page, there's a form that you'll fill out with just your some personal information. And once you fill that out, you will click on a little materials button that will pop up. And then after that, you will be able to have access to all of these materials. I think there's some images of what that looks like so that you can see. And then once you click on that, it will open. Perfect. It will have it broken down by the content area. So you can see for physical activity here, there's a link to the PowerPoint with the notes, as well as the physical activity resource. So I will go ahead and drop the link to that web page where you can access the resources in the chat, and I will pass it back to Khaleesi.
Thanks so much, Hannah. So in the implementation toolkit, like Hannah mentioned, we provide guidance and tips for planning and implementing the learning collaboratives. We really strived through Better Together and through this version of the learning collaboratives to create the most adaptable version of the materials that we possibly could. And we feel the tools and information provided could help a state project coordinator plan for implementation of multiple learning collaboratives across the state, or it could support a single trainer to plan and host a small learning collaborative with local ECE programs that maybe they're already working with in their area. We've included planning and implementation checklists also at the end of each one of those sections to help aid with this process, to help walk through the entire process. So some of these pieces, like there's a budgeting piece that may not be as relevant to a local implementation provider, like a local coach that's wanting to work with 3 or 4 programs that they're already working with. But we provided lots of different types of resources that help walk anyone through that entire process. And I'm always glad to talk with anyone about learning collaboratives. I just got finished talking for 2 hours about learning collaboratives a moment ago. But we're very happy to provide any type of support that we can to help you all get started if you're interested. So please feel free to reach out with any questions or support. And I think that concludes our learning collaborative portion of the presentation. If you have any questions, please pop them in the chat and I'll try my best to answer them. And I'm going to turn it over to our director, Rochelle Pace, for her to share with us about the Wellness Workbook.
Thanks, Khaleesi, and thank you, Hannah. And also welcome to all of our participants joining us this afternoon. We really appreciate your time. So today I'm going to walk you through our Wellness Workbook for Early Care and Education. I'll highlight some of the features of the resource and orient you a little bit on the website, so what it looks like online and how you can use it, and then just think through some uses and considerations similar to the learning collaboratives. This resource can be adapted for different users, different contexts, so we try to create and make something available to broad audience. So what is the Wellness Workbook for Early Care and Education? Well, in its current version, it's an online tool that promotes the creation of a wellness policy for early care and education programs. The updated version was translated into Spanish and is available on our website, and it was launched in 2022. But it has a whole backstory and origin story like any great Marvel character, so I will jump into that soon. The purpose of the workbook is to really help early care and education professionals assess, develop, monitor their program's wellness policies and practices. And similar to what we've already presented, it builds on our experience and our partners' experience and feedback in implementing nutrition and physical activity standards in ECE programs and settings. This latest version of the Wellness Workbook builds from some of our initiatives that were really focused on one-on-one coaching and customized support, but we try to take those experiences and develop something that could be used independently, but could also be used with the guidance and support of a technical assistance provider, a trainer, or a coach. As I mentioned, our origin story actually starts more than a decade ago in Florida. The first version of this workbook, known as Nemours Child Care Wellness Policy Workbook, was piloted and created by our colleagues in Nemours Florida Prevention Initiative, so I wanted to give them a shout out. And this work started with just about 20 ECE programs in Central Florida and grew from there. It included training, coaching, that really one-on-one customized support for in this case, ECE center directors, introducing best practices, policies, and helping them develop policy statements that they would implement for their programs. So a lot of the components we've already presented around action planning, evaluation, assessment, all with the intention of quality improvement of that childcare setting. Building on the evaluation findings from that smaller pilot, Nemours partnered with the American Heart Association in 2013 to really take this approach and resource to more communities and states. In this partnership, known as Healthy Way to Grow, the tool was once again adapted. It was then known as the Healthy Way to Grow Wellness Policy Workbook. We kept adding words to the title in each iteration. And in this instance, we trained child care health consultants, again, to support ECE program directors through this process of improvement, assessment, action planning. There was a smaller peer networking component than learning collaboratives. This program was more focused one-on-one in the center, but again, using this intentional process around best practices and policies. And so that program had quite a run from 2013 to 2021 in multiple states. It was evaluated by Child Trends, and they looked at a subset of programs. And in all, they looked at results in more than 360 ECE programs that participated in that initiative for at least a year. Again, those programs receive that individualized one-on-one TA, in this case from a locally trained child care specialist. Those programs went through the process of using self-assessments that were in the wellness workbook and developing their wellness policies, action plans. And the evaluation found that for those programs that participated, at least for 1 year, they developed more policies, provided more education opportunities, and more frequently monitored wellness practices within the participating centers. So we found there's a real intentionality around health and wellness policies and practices. It's also interesting to find that even with the reduced training in TA in the follow-on years of that program, that centers were still able to maintain some of the gains and improvements. So we really built off of these learnings to keep this resource going in some way, even as Healthy Way to Grow started to phase out during the pandemic, actually. So in 2021, we were looking at the final year of Healthy Way to Grow, and in partnership with American Heart Association staff, really took that prior PDF version hands-on tool resource that we had been using and figured out how we could translate it into a web-based tool for early care and education professionals. Both partners agreed to support continued use of the workbook. And we knew, given the pandemic, given shifts to virtual delivery, that it really had to live online. It just couldn't be a PDF resource that we all treasured. So we've developed the Wellness Workbook for early care and education. In 2022, Nemours invested its own funding to update the Wellness Workbook to better align with the 47 high-impact obesity prevention standards. We also went through and tried to simplify some of the language. We wanted to be more accessible to broader audiences, so we tried to simplify some of the overview language, and we also translated it into Spanish. So the whole website is available in Spanish as well, along with the program assessments, which we'll take a look at shortly. Similar to some of the components that were outlined for learning collaboratives and quality improvement, we have suggested steps for how the wellness workbook can be used based on Healthy Way to Grow and our other work in the early care and education portfolio. First, you would request a user login, and I'll let you know a little bit more about the purpose of that user login, but you have two options for requesting that. Once you're in the workbook, we encourage users to complete at least one program assessment. Some of them are very brief, some of them are longer. You can really pick and choose what's going to make the most sense for you as a program. And you'll be able to see your results right away, to see what you might already be doing in promoting healthy habits and where you can improve. Second step is really building on identifying those areas of improvement. Then you would create an action plan to help determine steps to implement policies, starting to assign roles, and we have some templates to support that. And then also with the aim of creating a wellness policy to really solidify your policies and practices and implement your plan. My team and I go back and forth between steps 3 and 4, if you should do one or the other first. And I think it can be really adaptable, what you feel the most comfortable with as a user or who you are supporting as a trainer. So I think there are definitely different approaches for implementing those action plans or developing those wellness policies. And my favorite step is to celebrate success, especially for early care and education professionals that are so overwhelmed and have limited resources, that any small improvement should be celebrated, should be shared with staff and families and the children, of course. And so we also encourage users to monitor and reassess your wellness policy regularly, and that can be done through the website and some of the resources there, or on your own as well. So once you go to workbook.healthykidshealthyfuture.org, this is where you'll land. And I just want to highlight some of the key features on the home page. So in the top right corner, your default's going to be English, and this is how you'll first see the website, but you can click on that top corner for Spanish, and it will flip the whole page to the Spanish version. The next thing you would do is log in or request a login. We're currently updating that, so you can request it directly from the website. Nemours is the administrator, so we would issue those logins for any users. So the purpose of the login is really to help you save your work once you're active in the website. There's no top secret information or anything that's super sensitive, but it's just a way for you to be able to save your work because there are a lot of assessments and a lot of questions, or if you want to go in multiple times, it enables you to save where you've left off. On your first visit, I'd encourage you to go through the introduction section, or even on your first couple of visits, provide some of the background information that I've highlighted here, just a suggested process for quality improvement and how you can use this resource. It also highlights some other key resources within the Healthy Kids, Healthy Future website, but also outside resources like CACFP. Once you continue down the home page, you'll reach the program assessments, which are really at the core of the wellness workbook. Now, the only section that's required, you'll see I've noted on the left side, is the first box, the ECE program registration. So we ask that you go in there first as a user, and we ask a few questions about you as the user, but also about your program. The section is required, but no individual question is required. So if the question doesn't apply to you, or you don't want to answer it, you don't have the info at hand, that's completely okay. Also, we know that different types of users might be interested in going through the wellness workbook or even reviewing the material. So it is geared towards program directors, family childcare home owners, but if you're a trainer or if you are just curious, you can definitely request a login. And when you go into the ECE registration for like program name, you can just say not applicable, I'm a trainer, or I'm just here to learn, I'm here browsing. That's all okay. You'll still be able to access everything once you go through that first step. After the program registration, there are 5 program assessments in like 5 broad topic areas. Nutrition and physical activity are seen here. You can complete them as many times as you like. You can start in any sequence. You don't have to start with nutrition. You can be physical activity. You can really choose your own adventure. Nutrition and physical activity are the most robust assessments just because they're the most standards related to those topic areas, and they're the ones we most recently updated in support of some work we are doing in New York. When you go further down the website, the second section of program assessments appears, and that's screen time, family engagement, and staff wellness. And there's a few other resources related to action planning and evaluation as well. So I will keep us moving along. Once you go into a program assessment topic area, you'll see they're each broken down into these 3 sections. There's standards, the environment, and education. And within there are multiple topics, and we'll take a look at those soon. And within those topics, there are the assessments. And the assessments can really be thought as smaller quizzes, and that's even what the learning management system that's behind the Wellness Workbook calls them. At first glance, it does seem like a lot. I'm going to be completely transparent. Once you start adding up the number of assessments, it is a lot. But I would like to highlight that most of the assessments are pretty brief. Some of them include just 4 questions, some are up to 12 questions, and they can be completed in 10 minutes or less. With our most recent group of users in New York, we're seeing users completing them in 5 minutes or less, particularly those smaller sections. Program directors, we have some family childcare home owners, they can complete them very, very quickly. Within the nutrition standards, the bold text here is the topic area. So I'm sure many of you are familiar with these topics and have provided support in them. We have breastfeeding, chest feeding, infant feeding, meals and snacks for toddlers and preschoolers, beverages, and other foods served. Now, another feature is you don't have to complete everything here. So if you don't serve infants, or if you're a preschool only program, like you can jump immediately to that section that makes the most sense for you. We've also, based on feedback from users over the last year, we've changed some response options so that because there's sometimes questions in particular that are for toddlers. So if that doesn't apply to you, we've provided some response options as not applicable. We don't serve toddlers, and it lets you continue into the other questions. On the eating environment, you'll see assessments related to modeling behavior and also using food and beverage as rewards and punishments. And also there's a section on nutrition education. A physical activity, again, it's broken down by standards, environment, education. There are fewer assessments. You know, it all starts becoming lower after nutrition just because there are less standards related to those. And again, here are the topic areas. We try to break it out by infants and toddlers and preschoolers. And the same principle applies. You can, if you just want to start with use of play space and equipment, you can do that and then go back later to the standards. It really does offer that flexibility. And then each of these topic areas have one assessment within them at the moment. So once you are in a program assessment, I wanted to highlight what that looks like. Again, it's built on a learning management system, so it's really set up as like online quizzes. You'll have your topic areas on the left-hand side of the screen, and at the top, it'll tell you the number of questions, and as you're answering them, when they're completed, it'll be this dark green color. It's usually a statement or question, and then the user would select the response that aligns the most with what their program is already doing. So for this example, we feed each infant on the infant cues unless instructed in writing by the parent or the child's healthcare provider. So you would select the response. So you continue on in the questions. In this case, once you finish all 12 questions, you would be able to see your results right away. And so this is what they look like immediately after completing an assessment. And you'll see the first question, the user selected most times, which is not the preferred or correct answer. So please in red, their response is highlighted in gray. And we do know that that gray is a little too light. So we're working on that. And then the preferred answer would be highlighted in green. And then on the other example question around offering infant cereal or formula that's iron rich, the user selected all the time, which was the preferred or correct answer. And that's highlighted in that double green. So you'll be able to see at the end, there also provides summary statistics and percentages, but we really want to highlight and encourage the user and program staff to focus on the answers and like sort of where they're already doing well and where they could improve. But we do know that those statistics can be very useful for trainers as well. As a user, and this is also why we have this login option, all your information is saved. So let's say you take all these assessments, you're tired, you want to go do something else, you can come back and look at your results later on. And there is a user statistics option or my reports, I believe it's called, and it'll show you in a similar format everything that you've completed. And it'll tell you the date. So if you took an assessment multiple times, you would see the date and time of when you completed it. So that's the program assessment side. Another great feature of the wellness workbook is it allows you and any user to create your custom wellness policy. We would love for everyone to do that after they've completed some assessments and see where they're at in different topic areas, but you can really go in and do it at any time. We've heard from folks that they just want policy statements. They just want an example that they can pull from. So this enables them to pull that for themselves. So once you're on the home page, you would go to My Wellness Policy at the top menu, and you do need to be logged in. And it will, again, we should try to use your self-assessment results, but you'll be able to create a policy for any of the available topic areas. And in this demonstration, we're going to do just nutrition. So this user can select different policy statements that they would want to include in their wellness policy. And it really is a menu. You can mix and match depending on what age groups you're serving, what you want to include in your policy or work in your action plan. They can really be connected. Here, this user is going to select that providers gently encourage children to try fruits and vegetables, and serving less fried or pre-fried baked vegetables. So we're just going to be clicking through different options. And this will really depend on what the user wants to work on. And this could be different summary policies at different times if they wanted to. So they're going to not serve milk, flavored milk or juice. And you'll just keep, and you'll see there's a whole long list given just all the content. And we do introduce a lot of these policy statements in the actual program assessment. So it is always the last question. And so it's going to produce a PDF, you'll save it, and then it's your policy. And it'll include your program name that you used when you registered. And if that's not coming up, you can let us know and we can make sure that's programmed into there. And so this one will be our nutrition policy. And you can put that on a bulletin board, put it in a family handbook, pass it out to your staff, to your families. It just gives you that option. And here's a version of a customized wellness policy that includes multiple topic areas, but it's created that same way, selecting different policy statements.
All right, Rochelle, we have a question.
Yeah, I see there's a couple questions. So
Monica wants to know, could a TA provider or state organization see what their sites are doing within the assessment, and can they run any kind of report?
yeah, so thank you. That was one of the features I was going to mention soon as well. So Nemours is the administrator of the site, but if you contact us as a trainer when you set up your account, you can let us know that I'm going to be supporting ABC childcare program, and we will link your account to that user. So then you'll get another reporting feature in your profile and be able to see their responses the same way they would be able to see the responses. And I keep looking at the screen as if I'm speaking to Monica because I see the question there. But yeah, you would be able to be linked to however many programs you're supporting. That's how we have it set up in New York currently as well. I will say one of the limitations at the moment is that you're going to see all their responses and statistics in PDF, but one of the features or support that Nemours can provide is we can provide summary reports in Excel. So if you let us know, I have a program that's completed all assessments, we can develop an Excel workbook that summarizes all of their information and what responses they selected compared to the preferred response or correct response for that question. So that is possible. I want to be sure we have time for any other questions also. And I just want to highlight some of suggested uses. Our intention with the wellness workbook is really to ensure that its legacy would be living online, and it was another available resource for early care and education professionals, trainers. So we do think a suggested use is that it's self-guided. It can be used in its current format by an ECE program director or owner, family child care home. But we also think you should consider that these are very overburdened staff, so be sometimes with limited time and resources. So that might be a challenge for them to be self-guided, but we do know that they're amazing professionals can definitely do it on their own. It can also be integrated into a training technical assistance program like the Learning Collaboratives. It is an option. You should consider if your state or community has existing self-assessment tools. We do think that it helps with Learning Collaboratives to be building on existing local resources, but if not, this is certainly an option. Be connected to other state or local health and wellness initiatives. We're using it currently as part of New York's Creating Healthy Schools and Communities. We have 130 users from New York that have been using the current version of the wellness workbook. There are some additional resources and support that are needed to use it in that kind of setting. It could also be used as part of a recognition program for healthy eating and physical activity, either the wellness policy document creation or the self-assessment, or both. So I think you would just need to think through how to use the resource, because there's a lot there. So how do you keep it manageable for programs? It's also an additional resource similar to how it was used in Healthy Way to Grow in some of our past work for childcare health consultants or childcare specialists. It's online, it's available. It can be another resource to really support integration of best practices into childcare programs. So you might want to think about how you could promote the use of it, or if child care health consultants would need some more training or orientation on the tool. Just wanted to summarize the key features of the wellness workbook. Again, it's available online in English and Spanish. We've integrated it into the latest version of the learning collaboratives. User accounts can be linked, so there can be some coaching and support for users. We've developed some tutorials right now for New York, just on how to get started with the website, how to see your results, how to see results of programs you're coaching. So we're going to make those for a broader audience soon and post them. As I mentioned, we can create some summary user reports. Right now, it's still within the admin level, but we can definitely provide that support. And we also have a PDF version of the wellness workbook. Of course, we would love everybody to go online, but we understand if folks still want to use a PDF version. I myself am a paper and pencil person, so if you want to use both at the same time, that's available as well, and we can share that out in the follow-up. I think it's currently on a Basecamp website, and we do have the PDF in English and Spanish. And so that is your quick run through of the wellness workbook for early care and education. And I know we have 7 minutes left. If there's any additional questions in the chat, or if people want to come off mute, they're certainly welcome to do that.
I think we've addressed all the questions in the chat. Anyone else have any questions?
I have one. Have any of the previous versions of this been utilized within a state's QRIS?
No, not that I am aware of.
And the online version of the wellness workbook was just released in 2022. So we're still piloting it in New York and hoping, if other states are interested in using it, who knows?
Hi there, this is Tina. In regards of the other states like New York and Florida, how are they funding their wellness policy assessment?
Yeah, so in New York, it's part of a subcontract that we have with it's actually with the prime recipient that's leading the Creating Healthy Schools. So it's integrated into another component, and it's just one piece of work. Like we provide a lot of technical assistance beyond the wellness workbook to the state. So it's just one component of it. That's how they've done it. In Florida, there was some local foundation funding when the work first started. And it was pretty small, it was like 20 programs. And then Healthy Way to Grow, when they used the resource and expanded, that was also foundation funding.
Okay, thank you.
Sure.
Hi, Rochelle. This is Teresa Cohen from New York.
Hi, Teresa.
I'll just add a plug for the Wellness Workbook. It's been great for our use. I love how it's got the assessments, the action plan, and then those policies right there available for applying to the best practices that our grantees are working on with ECE providers. And I'll just add to the funding piece. We use state funding in New York State. We're fortunate enough that we have state funding, and that's what funds our grantees to work with the early care and education providers, and also kind of pays for the subcontract with Nemours for this work.
Thanks, Teresa. Appreciate that. Chris and Candace, I see your question. Have states that you like go knapsack also use the wellness workbook? I mean, not at the moment. Like right now, as Teresa mentioned, we've been using it in New York, and then this is our broader opening if anyone else wants to use it. And then when it was a PDF resource, it was used at a local community level through Healthy Way to Grow and in Florida. And so there might be some other programs at that point that were using Go Knapsack paper version too. But I don't, at this time, I don't think anybody is using the wellness workbook in a Go Knapsack state.
And just to answer Judy's question also about the difference between the resources we've shared today and Go Knapsack and the Better Together version. Everything that was shared today can be used by any state, whether they have a Go Knapsack license or not. For the learning collaboratives, if your state has a Go Knapsack license, we certainly will encourage you to use the Better Together version because Go Knapsack is fully built in and incorporated into the learning collaborative framework. For the purpose of everything that we've presented today, any state can use it. And we want to make sure that we have an option for states that don't have a Go Knapsack license as well. So I don't know if Rochelle wants to share any more about that, but all of the resources we shared today are open source and are available for use for anyone at no charge.
Yep, that's exactly right. I think we would just encourage you if you're deciding between different tools, just to be sure just to be aware of what is in your state so it doesn't cause confusion for providers or participants. I think we just want to be very sensitive to that.
Awesome. Well, Hannah dropped in an evaluation link into the chat box. We would love to invite you all to complete that. It's just a couple of quick multiple choice questions. And then I just wanted to plug the next resource showcase session. It's going to be on April the 4th. I think we have a slide. We're going to be another Nemours associate, Rebecca Duchette, which I think is on here with us today, and many of you all might know her. She's going to be presenting on the Nourishing Healthy Eaters work that we have done over the last several years. And then we're also going to be presenting on some family engagement resources we've developed, especially the Better Together family cafes that were developed in partnership with Curricula Concepts in Arkansas. So I look forward to sharing that with you all on April 4th, and that will be at 3 p.m. Eastern Time as well. And that is all. If you all need to contact any of us about any of this information that's shared today, please feel free to reach out. We're more than glad to answer any questions that you might have and to support you on this journey. And we just want to thank you all once again for joining us. And we're excited about the launch of these materials and to hear any feedback that you have about any of these things.
Thanks, everybody.
Thank you.